My name is Dr. Cory Orava. I'm a trained veterinarian. I was in practice with horses for almost 10 years. And about a decade ago, I had the opportunity to start working with stem cells. I looked into the research and realized that stem cells are going to change medicine. In the veterinary field, we were lucky. There was much fewer regulations, so we were able to treat cats, dogs, and horses, and we amassed a huge amount of data. What we realized is stem cells are working in many, many ways. They don't just turn into things. That's what people historically thought of stem cells. They could just turn into a tissue. We now know that's the tip of the iceberg. What these cells are doing is acting like a conductor. They're standing in front of an orchestra and coordinating healing. They're taking cells from different types of the body, different parts of the body, and telling them how to heal. One way they can do it is controlling inflammation. Everybody knows what inflammation is, and we know that too much inflammation is not a good thing. Stem cells can reduce inflammation, but they can actually do more than just reduce inflammation. They can actually change the immune system. There's part of the immune system called a white blood cell. Some white blood cells are pro-inflammatory. What that means is they want to make more inflammation. They're kind of the bad guys. When they get out of control, you end up with too much inflammation, and you usually end up with pain and then stuff falling down, hurting, not getting better. Stem cells can actually take those pro-inflammatory white cells and turn them, make them anti-inflammatory. So it's kind of like taking somebody, let me see, who's a bad guy and making him a good guy. It's as simple as that. They do have the ability to turn into tissue as well. But what we've learned recently is not only do the stem cells have the ability to turn into specific tissue, say cartilage, they can actually tell other cells to turn into tissues. So it's much more complicated than we first thought. I believe in this technology so much that I actually had my wife treated with it. She went to the Kansas Regenerative Medicine Center. She had a nerve injury. So on the inside of her ankle, everybody knows there's that bulge there. That's a bone. It's the part of the tibia, the medial malleolus. Underneath it, she had a nerve that she had an injury from running. She had surgery. After surgery, she had some scar tissue. It made it even worse than it was originally. She had a second surgery where they removed the scar tissue and then put a little sheath to kind of protect it from any new scar tissue. It was better, but she was still in chronic pain. She had to give up running. She couldn't downhill ski anymore because the pressure of the ski boot was too much on her ankle. Even sleeping at bed at night, she would take her foot and put it on top of the covers because the pressure of the covers on her nerve was too much for her. She was on tramadol and gabapentin, which are two potent anti-pain meds, for the last 5 years. After getting treated at the Kansas Regenerative Medicine Center, she is off all of her meds. She's not normal, she is not pain-free, but she's running again, she's skiing again, and she's off all of her meds. It still hurts now and then, but it's usually nothing more that Tylenol or ibuprofen can't help, as well as an ice pack. So I'm not just explaining things from the science point of view. We actually have personal hands-on experience and believe in the technology and just can't profess it enough.